Hello, my name is Sandra Husbands, Director of Public Health at ABMU Health Board. Welcome to my 2017 annual report, which will focus on health literacy.
What is health literacy? Health literacy is about knowing what to do to stay healthy, to improve your health, or to manage your disease or condition, and then actually doing it. You can think about it a bit like computer literacy. When we say somebody is computer literate, we don't mean that they know all about the internal workings of a computer. What we mean is that they know how to use a computer to get what they need out of it. They'll know about some software or apps, and they'll know some basic troubleshooting for when things go wrong. At least they'll know to turn it off and turn it back on again. Importantly, they'll know when and where to get help if there's something they can't fix themselves. Health literacy is a bit like that. Basically, it is about being able to find, understand, and use the information you need to protect, improve, and support your own health and well-being, or to manage any conditions you might have. There are several definitions of health literacy, and some of them are quite complicated. The definition we use in Wales goes like this. Health literacy is the ability and motivation level of an individual to access, understand, communicate, and evaluate both narrative and numeric information to promote, manage, and improve their health status throughout their lifetime. Some points to note in this definition are, first, that it includes motivation. This relates to the fact that it's not enough to be able to find and understand health information to stay healthy. You need to want to apply it and keep on doing so. Second, this Welsh definition stresses that you must be able to understand information that's presented in numbers as well as words. Even some people who are very literate in the usual sense, and may well be educated, struggle to understand health information because they find the numbers and statistics confusing. Third, this definition of health literacy makes it clear that you need to make judgments about whether or not the information you've got is good and credible. You must evaluate it before you can act on it with any confidence. Health literacy is important because people who have low levels of health literacy have worse health than people who are very health literate. People who have low health literacy are more likely to die at a younger age. They're more likely to have unhealthy lifestyle behaviours like smoking and drinking too much alcohol. They're more likely to have long-term health conditions, and they're likely to find it more difficult to manage their conditions. Although we're not measuring health literacy directly in this area, we think it's probably going to be a big problem for our population because health literacy is linked to both deprivation and education levels. In this area, between 10 and 14 of every 100 people have no qualifications at all, and less than 4 out of 10 are educated to degree level. We know that we have some of the lowest levels of healthy eating and physical activity of any area in Wales. We have far higher rates of tooth decay in young children than most of the other parts of Wales. In Neath Port Talbot, 3 out of 5 adults are overweight or obese, and nearly half of them are drinking higher than recommended levels of alcohol. We also have, on average, higher rates of early deaths from conditions such as diabetes, stroke, and heart disease. We have the highest proportion of people who have a long-term condition who've had to stop working because of it. We know that certain groups in society are more at risk of having low health literacy than others. These groups include people of ethnic minorities, older people, people who are poor, people who live in deprived areas, and people who haven't had very much in the way of formal education. These groups are more likely to have low health literacy, and so health literacy contributes to health inequalities, making it an important public health problem.
About a year ago, I had an incident where the communication was very poor. She wouldn't explain things properly to me. She'd over talk and just wouldn't take any notice. In fact, sometimes I didn't know if I was there or not. She was quite abrupt. But at the end of it, the nurse took over and explained everything, and it wasn't too bad, but I was reluctant to see her again.
I have noticed with our own GP surgery, with the older doctors that have all now retired and the new doctors, younger ones coming through, are much more communicative. Personally, if I don't understand anything, I'll ask for clarification, but not everybody perhaps would have the confidence to do that.
When I've been to the doctors and dentists, they always talk to me differently to adults because obviously I don't understand as much. So I find it easy to understand.
I'd find it easy to understand them because they speak understanding my age, and I'd ask any questions if I didn't understand.
Individual doctors, nurses and other health professionals need to try and understand whether the patients they're working with are very health literate or have low health literacy. They need to change their style of communication to suit. These health professionals must also then find out whether or not the patients understand using techniques like teach-back, for instance, where you give a patient some information, maybe how to look after their diabetes or how to lose weight, and then you get them to teach it back to you. That way, you know not only have they heard what you said, they've understood it well enough to be able to teach someone else. Doctors, nurses and other health professionals also need to ensure they're having motivational conversations with their patients, tapping into and increasing patients' motivation to apply what they've learnt to their own lives. Some people report feeling confused by health messages. The media can sometimes sensationalise health-related news stories or provide non-evidence-based information that contradicts NHS advice, leaving the public unclear about what to believe.
Certain publications have a reputation anyway for distorting evidence, so I would certainly take their publications with a great pinch of salt. And you can always look through an article, online even, or printed, to see how they base their research on what other articles. So you can go through a chain to see what was written.
Dwi'n meddwl mae'r negeseuon yn dod trwodd, ond yn y pen draw, bys i'n meddwl efo lot o bobl mae'n cael effaith, ond dwi'n meddwl efo rei pobl hefyd, ti'n clywed y neges yna, ond ydy o'n cael effaith, dwi ddim yn siŵr os mae, mae'n bwysig gael y gwybodaeth allan yna, o ran 5 a day a pethau fel yna, ond y broblem ydy rwan, mae'n gymaint o gwybodaeth yn dod allan. Dwi'n meddwl mae pobl yn bombarded efo negeseuon o fatha, mae protein yn dda, mae carbs yn ddrwg, mae'n gwahanol math o carbs yn dda, mae'n rei yn ddrwg, weithiau mae tatws yn dda, mae tatws yn ddrwg, a dyna di peth, mae'r ffaith bod yn gymaint o gwybodaeth, mae pobl jyst yn meddwl rwan ar diwedd y dydd, ti wedi cael diwrnod brysur, stressful, ti'n cyrraedd adres, ti'n meddwl, stuff it, dwi'n mynd i agor botol o win.
So where do people generally get their health information from? Of course, doctors, nurses and other health professionals can be popular sources of information for many. Family and friends can also provide us with health messages, some of which may not be based on good evidence. An increasing amount of people now access information online, from websites, forums and social media. Many people we talk to only believe online information if it's been written by a credible source, such as the NHS. More traditional media is still a popular source for some, including radio, TV and newspapers. Again, some of the messages given here may not always be correct.
I'll go onto the internet just for some basic information, but if it's something really serious or what have you, I'll either ask my wife, who's an ex-nurse, or my son-in-law is a nurse as well.
I either ask the doctors, look it up on Google, or ask my mother or my father.
Y dyddiau yma, i ni'n tueddol o defnyddio Google, ond mae defnyddio Google gallu bod tipyn bach yn peryglus achos gall rhywbeth bach troi allan i fod yn rhywbeth enfawr. Felly, i sicrhau bod y gwybodaeth fi'n defnyddio'n gywir, dwi'n defnyddio wefan yr NHS yn fwyaf na unrhyw beth arall nawr y dyddiau yma.
Fel os dwi'n gweld rhywbeth ar y weithiau dwi'n meddwl efallai dydy e ddim 100% yn gywir, ond wedyn os dwi'n gweld rhywbeth ar wefan yr NHS neu bwrdd iechyd arall wedyn dwi'n credu mae'n gywir a dwi'n credu be maen nhw'n dweud.
This report is a call to action for us to work together to improve the health literacy of the population. The recommendations are that we first find a way to measure health literacy in the population and start measuring it on a regular basis. Secondly, that we provide some training for health professionals so that they can better support people that have low health literacy. And thirdly, that we work with our communities and bring together a coalition to improve health literacy for the whole population.
Hopefully you now know a bit more about health literacy in Swansea, Neathport Talbot and Bridgend, why it's important and its impact on our population's health. With improved health literacy, people in our population will have healthier lifestyles, will use healthcare less and will lead longer, healthier and happier lives. Thank you for watching. Goodbye.